Welcome back to Your Health television program. I'm Dr. Elisa Hernandez, and today we've been speaking with people in the field, in the front line of the HIV/AIDS efforts here in Monterey County. This year, 2011 commemorates 30 years of the first reports of the AIDS, and this program we're kind of reflecting on what we've seen, how things have evolved for HIV efforts here in Monterey County. My next guest is Patti Yurus, and she is the charge nurse of the Outpatient Immunology Services Clinic, or OPIS, so I will call it OPIS for short, at the Community Hospital of the Monterey Peninsula, or CHOMP. Again, I will use those two words because those acronyms are shorter than the mouthful. She's been a registered nurse for 27 years, and she started her nursing career at CHOMP. And she was working on the designated HIV/AIDS floor of the hospital. And then after that, she spent about 3 years there, and then after that she rotated to other departments, including the emergency department. After several years, she came back to her first passion. In 1992, she joined Opus Clinic, where she has been working there. And I'm going to talk with Patti now about some of her experiences and memories of HIV/AIDS here in Monterey County, and kind of enjoy the conversation. Thank you, Patti, for coming.
Thank you for having me.
So what were your first memories of HIV/AIDS?
Well, I think that personally it was a time when my husband and I were dating, and prior to HIV, the most often asked question in sexually transmitted diseases was, did the person have herpes? Because at that time that was the one untreatable STD. So HIV, began to be out there, and I think people began to be more aware that it was sexually transmitted. From a professional level, I remember that patients were ostracized. There was talk of they need to be quarantined. Patients, as you well know, HIV erodes your immune system, and patients came down with opportunistic infections that we had never seen before. And some of them were hard to even look at, and certainly we had wasting back in that time frame. So it was quite a different face than it is today in 2011.
Yeah. Now you remind me, my first patient that I had as a medical student had AIDS. So a lot different. I think the guys and gals on the ward now would never see my patient. So
pretty much,
yeah.
Unless somebody wasn't aware of their status and ended up in the emergency room and maybe had pneumocystis pneumonia, then they would be admitted. But it's rare that we see opportunistic infections in people who are certainly on antiretrovirals now.
Right.
So yeah, they still carry the AIDS diagnosis, but they're not having the complications. So.
Right. And so your perspective professionally was definitely from the hospital unit wards. What were your feelings about how people felt about HIV and AIDS out in the community?
Well, I think that there was a lot of conflict. People were very afraid. They didn't believe what they were being told about the transmission routes. My own mother said, well, what if you're in the room with a patient and the mosquito gets in and bites the patient and then bites you? And, I think there still persists even some of that unsuredness that, are you sure you can only get it by those 4 routes of transmission? And so I think out in the community it was definitely very scared. I know that even the people that passed the trays, the food trays in the hospital, there was a lot of, well, they shouldn't use the regular silverware. They should all get disposable trays and disposable plates. And it really felt to the patient that they were being ostracized and almost quarantined in a way. So that has definitely changed in this day and age. So at CHOMP, what were some of the early responses that were occurring there in terms of HIV? Well, certainly the clinic, Opus Clinic, was opened in 1990, and that came as a direct cause and effect of patients being hospitalized, and after their hospitalization they would have no really doctor to go to. The hospital had hired an infectious disease doctor, Dr. Geraldine Taplin, who is the clinic's medical director, and she really was the heralding person to show people, lead the way, and set the example that she would go into patient rooms and sit on the patient bed and hold patients' hands and to decrease the fear that was out there. So the hospital developed outpatient immunology services in 1990. Dr. Taplin became the medical director and really made a commitment to serve people with HIV regardless of ability to pay. The hospital started to, Suzanne mentioned, grants, started to look at what grants were available for people who had no insurance and needed care. So they have pursued that yearly since that time. And they've just remained committed to supporting the clinic and the efforts to care for people with HIV and AIDS.
So Dr. Taplin would start seeing the patients, or any of the other clinicians would see the patients as an inpatient while they were still in the hospital, and then continue their care
in the outpatient setting. Exactly. And the then coordinator of the clinic, Mary Dugam, she did, and Dr. Taplin went to other models, to Santa Clara County, San Francisco, and took what was best about those clinics and modeled to make Opus. And then shortly after that, Natividad opened a sister clinic called Natividad Infectious Disease Outpatient, modeled also after Opus's. So yeah, it's been an interesting 30 years, and although I haven't been quite there the whole 30 years, the clinic back in the day, we would do transfusions, blood transfusions for people who were anemic, medication infusions, just plain hydration, injections, things to support their white blood cells and red blood cells. We did lab draws there, and we still do a lot of that, but certainly the patients are not requiring what we used to have, every single bed, 3 beds in use on certain days at the clinic, and mostly they go just for exams now, their regular every 3-month exam with the doctors.
Oh, that's neat. It's neat to hear how things evolve, and also I bet you some of the parts, besides the fact that patients are healthier, is that it's more accepting, so that you didn't have to have that special phlebotomist to draw the blood and have separate surfaces for some things. I think it's still, I'm sure you provide special services at Opus that are catered to the patients.
We do, and I think that Opus has always been a very open, safe place for patients to come, and they really appreciate that. And the patients, I think, feel that they have some stigma still. There's still certainly a stigma with this diagnosis, but I think it is overall better now versus then. Certainly, I don't think that, and certainly with people coming out more in the media over the years, and we saw that in the 80s more so than we have recently, but it's, there's people talk about it on TV shows now, and so it's getting its recognition and becoming less and less stigmatized.
Yeah, I was thinking about that this weekend. My daughter and I were watching TV, and she's 8, and she was asking me questions that I know I never would have asked at that age, because it wasn't ever talked on talked about in TV or just in casual conversation. So I think we've definitely been, we've evolved. How did most people hear about Opus or hear about Opus now? How do most patients come to the clinic?
Well, then and now it's word of mouth. Nowadays we've got the internet, so you can Google HIV/AIDS Monterey County, and the website will bring Opus up. I think that the doctors in the area are all aware of Opus Clinic, and that it's well known that best practices do say that you want someone who is HIV trained, and Dr. Taplin certainly is, and you get better outcomes with patients. So I think that the CBOs do a good job of sending people to us, people who are just coming into this area, moving here for the first time. They can contact the CBOs, Central Coast HIV/AIDS Services, CHAS, and be referred to either the NIDO clinic or Opus Clinic, depending on their area of residence.
Right.
So.
And you mentioned when patients were coming into the clinic early on, most of the care that you gave them were more, it seemed like it was more supportive before we had antiretroviral medications. Can you talk more about how treatments evolved once we were able to have more medical innovations and medications?
Certainly, because in '87 the only class that we had was the nucleotide analogs, nucleotide analogs, and as more drugs were FDA approved, we had by the 95, 96, we had 3 classes of drugs, and that's really where the cocktail that was always referenced in the media was really helped us understand that if we went after this virus in different areas of its replication, that we could control the virus and bring people's viral loads down, letting their T cells flourish and their immune system flourish. And so the treatments, the supportive treatments that we used to give became unnecessary because most of the opportunistic infections can be pretty much alleviated by having your immune system intact. And so by doing that, giving 3, sometimes 4 meds from about 95, 96 on, I think in the county, the death rate went from about 40 a year to about 10 in just 1 year's time.
Wow.
And then now I think we as a clinic have only lost 1 or 2 people in the last year. So it definitely, the longevity of people's lives, it's no longer that death sentence that it was in the early 80s. And much better decade to have HIV this decade is compared to the 80s when it first surfaced its ugly head.
So now you're dealing with patients with AIDS as well as diabetes or things of old age.
Coronary artery disease and yes, hypercholesterolemia and bone density problems. So yes, we're seeing them. It's definitely becoming a primary care issue is the people are getting older and having the normal things that happen to people. So although HIV still remains a inflammation aggravation for the end organs in the body, so
still an issue.
Still an issue.
So what are some of the messages for prevention and treatment that you give your patients, and have they changed over the years, or is there same things you keep telling them?
Yeah, it's pretty much that. We try not to do too much, but I have been known to do that, and it is almost every patient after being diagnosed, and we get to the part about where I'm, are they aware of safer sex, and are there any partners that they need to notify? They all say, oh, I'm never going to have sex again. And, I say, sure, but till the next time, condoms, condoms, condoms. And really, condoms are still the best and most effective way to protect yourself against any STDs. So the message has not changed. I think it still is, have the talk with the person that you're considering having sex with. Make sure you're equipped, make sure you can have access to a condom, make sure that it's there, make sure that you tell your kids that this is what they need to do to protect themselves as well as they grow into those years of age where they might be considering having sex with anybody. So the message hasn't changed, I don't think, over this period of time. So.
Still a challenge to get it through, yes. So what do you, in the last 30 years, what are some of the benchmark events whether in popular history that you think might have impacted how people responded to HIV and AIDS?
Well, I think that the biggest thing for me is that the third class of antiretrovirals were FDA approved in that 95, 96 time period, and we really got a hold of understanding the antiretroviral combination therapy. And then since then, there are 2 other classes that have now been FDA approved. So now we have 5 classes of drugs, and that the drugs themselves have gotten less of a pill burden. In the early days, people had to take, handfuls really of pills, maybe 6 pills of one type and 2 pills of another twice a day. And now there's even one medication that has 3 drugs in one pill that you take once a day. So things have definitely gotten better since that time. I think it was interesting for all of us to realize it was, Magic Johnson came out, it was 20 years ago? I would have,
we can look at the timeline.
I would have sworn it was more towards mid-90s, but it was 91. So I think it's, and everybody thought that he was done playing basketball, and here he is going along, and he's taking his medication. So I think adherence to medication is the big issue, and the fact that we have the meds now, which is also a double-edged sword, because I think the younger kids think they've never seen the face of AIDS, they've never seen the deaths that we had in the early days. I lost many, many patients who were wonderful, wonderful people to this disease, and I think the younger kids have not seen that, and they just think, oh, if I get it, I'll take a pill. And that's really the complacency part that I think we need to get that message that, don't get it in the first place, because it's still not fun. And unlike diabetes, you can't give diabetes doing the one act that human beings do, but HIV you can give, and that's an important message, I think. So.
Well, I have one last question for you. You kind of talked about some of the medical efforts and advances that we have. Do you think we'll ever find a cure, or do you think there's hope for the vaccine?
Well, I do hope that we do find a cure and a vaccine. And I think, the vaccines have been very difficult because the virus mutates a lot, and they haven't really been able to completely make the immune system target the virus. I think a cure, I think what we have done with the antiretroviral medications, by lowering people's viral loads, keeping them what's called undetectable, they are still in the body but lurking, we think, in the lymph nodes, in the gut. The transmission rates with low viral loads definitely will be less as a public health issue. So I'm hopeful, and I'm hopeful that I'm certainly not one of the people that thinks that the drug companies are just trying to, make money on these medications, because I really think that they are putting research money into R&D to develop a cure and a vaccine, and I'm hopeful. I hope it happens in my lifetime.
I hope so too. Well, thank you, Patti. We're going to take a break now, but I want to thank you for first coming to the program and sharing your experiences with us, and also thank you for the hard work that you do at OPIS. We definitely have all benefited here in the community from your work at OPIS, and thank you for your time.
My pleasure. Thank you.
We're going to take a short break. This is Your Health television program, and I'm Dr. Lisa Hernandez.